Assalamualaikum and very good morning to Midam, to Maharom and to my fellow friends. Today, uh, I'm going to present about our project, which is Smart Community Health Monitoring System project background. So in this project, we aim to improve local health outcome by monitoring by implement the system which is called DHIS2. It is also to enabling real-time tracking of symptoms like fever through this platform. So the system is open to all age of groups. It emphasizes accessibility, proactive healthcare, and also time efficiency. So in this project, we apply key project management principle, which consists of planning, execution, and evaluation. So while collaborating with professional healthcare authorities and also stakeholders to ensure community needs are met. So by fostering the data, managing resources and maintaining the quality, it promotes the adoption of data-driven system that connects to each community and also effective management. Problem statement and objective. In this project, the problem statement first is inadequate data management system. A weak management system gives an impact to its effectiveness and its reliability as a result to potential of software bugs, device complexity, and so on. Secondly, ineffective coordination and communication among team members. So we have a different background and skill sets, have made it difficult to execute work among team members and occur to delays and misunderstanding in context of conflicting schedule and collaboration with other party. Thirdly, insufficient system towards current monitoring and evaluation. So the process of adapting community needs and its effectiveness is crucial regarding lacking of mechanism for tracking progress. So for the objective in this project, first, we aim to implement real-time healthcare monitoring by propose this platform DHIS2 as a benchmark for real-time health monitoring system. Second, to acknowledge the community about health technology to improve their literacy about health. So third is to spread awareness about health, to spread broadly about health awareness basically. So we encourage the community to pursue good health with a way of monitoring their health regularly. Our scope in this project, first, economic independence. Develop and implement a user-friendly DHIS2-based health monitoring platform for community symptom reporting, including testing and deployment. Secondly, community engagement and education. So we conducted outreach program or activities, including home visits to educate the community on using this monitoring system. And thirdly, data collection and analysis. This is very important for professional healthcare to gather and analyze community symptom data to track trends and identify health risks, monitor data flow.
My name is Farah Aina binti Muhammad Effendi and I will explain about the risk analysis. These tables show potential risks, their cause and how we manage them. By addressing this risk early, we can keep the project on track and meet our goals. So first, technical problem. The team might face technical problem with DHIS2. So to prevent this, we provide training and have support team ready to fix any problem quickly. Next, community participation. Low community participation could happen if people don't understand the system. We will work with local leaders on awareness campaign and collect feedback to improve adoption. Next, for data issue, user might report symptom incorrectly. We will give clear instruction and have team regularly clean and review the data to ensure accuracy. Furthermore, project delay. Project delay might occur without proper planning. We will create a detailed timeline and if needed, adjust priorities to complete the critical part first. Lastly, health misunderstanding. Some community member might misunderstand health information. We will offer education session and provide support to answer questions and avoid harmful decisions. So let's move on to the project planning and cost calculation. So our total project cost is 2,320 ringgit. divided into 4 categories. So the first category is technical equipment. For DHIS2 system, flyers and consent form, which are crucial for gathering and sharing information, 100 flyer cost RM1.50 each, amounting to 150 ringgit. Next, personal cost. This includes allowance for 10 volunteers and transportation cost for 3 cars, total 1,150 ringgit. For equipment cost, we are using 10 demo mobile phones for data collection with no extra cost as they are personal device. Last, miscellaneous cost. This cover refreshment for 100 participants, costing 500 and a contingency fund of 500 to handle unexpected expenses. So right now, let's move to work breakdown structure, WBS. So first, initiation. This phase involve forming the team, selecting the topic, and defining the scope, objective, and deliverables. We also create a project plan and communication strategy. Next, for planning. During planning, we hold meeting, introduce the project and assign role. We also estimate timelines and plan budget and engage with the community through outreach and research. Furthermore, education. In this action phase, user update their health condition through the developed interface. We monitor, collect and analyze data using tools like Google Form to gather response. Lastly, close out. Finally, we wrap up the project by reviewing results, completing reports and delivering the final presentation. A post-mortem is also conducted to identify lessons for future improvement. For the next slide, I will pass to Harid. Thank you.
Let me introduce myself first. My name is Muhammad Harid bin Bahrul Jamal. Okay, I will explain about timeline of the project, or we call it Gantt chart. As we can see at the chart, the project is divided into 4 phases, which is initiation take the duration for 10 days, planning take the duration for 27 days, next, the duration for execution is 18 days, and lastly, close out phase only take 3 days. Total duration for the project take 58 days to run it. So for the next slide is activity on note. Activity on note for network analysis. We create a table that contains some activity, predecessor and also the duration for the task. The table indicates that the grouping activity has no predecessor, so it can start immediately. And some activity relies on each completion of other activity. Based on the table, we construct AON network diagram by following the predecessor and duration for each activity. As the results, the critical parts, which mean the longest part for the project without delay, is A, B, C, D, E, F, G, I, and J, and the total of completion time for the project is 58 days. So, I pass for the next presenter, Yap Hock Soon.
A very good day to Madam Hanum, and I'm Yap Hock Soon. Thank you, Muhammad Harid, and I will be presenting about project methodology and EVM, Earned Value Management. So our project starts with planning and project research, and second, develop district health information software DHIS, and we'll collect all the data and analyze it. If the data says yes, we will go to the feedback and action, where based on the survey result, action plans are created to address any identified health concern or area for improvement highlighted by the community. If the data says no, the collected data is analyzed to detect trends, anomalies or early warning signs of community health problem. And now we proceed to the next part, earned value management. In this case, the PV is 1715. The value indicates the plan's progress and spending at this stage of the project. Here EV is 1810, indicating that more work has been accomplished than original plan. This suggests that the project is ahead of schedule in terms of progress and value. In this case, AC is 1370, indicates that the project has spent less than the budget allocated for the complete work. With an SV of 95 positive, the project is ahead of schedule. However, CV of 440 positive, the project is under budget as the cost incurred for complete work is significantly less than the value earned. And SPI of 1.06 indicate that the project is slightly ahead of schedule. And CPI of 1.32 signifies excellent cost performance, where the project is delivering 1 ringgit 32 of value for every 1 ringgit spent. So that's all for my part. Thank you, madam, and I will pass my presentation to Alif Afifi.
So thank you, Yap, for your explanation. So the last one is from me, and my name is Muhammad Ali Afifi bin Muhammad Baharudin. My number metric is B09221026. So for the expected result, we can see from this system, we designed to foster a proactive health culture within communities. So by leveraging the DHI S2 platform, the system simplify health monitoring through mobile device, so that it easy for user to track their medication and treatment. So this initiative is expected to cultivate healthier lifestyle choices and increase personal responsibility for health. So from the discussion, we can get that this smart community health aim to increase public engagement in personal health management. So this project has involved recruiting participants and volunteer to enhance outreach data collection at the Taman Desa Idaman, Durian Tunggal, Melaka. So when the result has promising, this can acknowledge the certain limitation in the study and offer recommendation for the future improvement. So we can see that the smart community system have impact at the SDG. For the first one is the SDG 3, good health and the well-being, and the second one is the SDG 4, quality education, and the last one is SDG 10, that reduce inequalities. So for the conclusion, we can get that the smart community health system represent a transformative approach to community healthcare by enabling real-time health monitoring and data-driven health management. So this initiative empowers individuals to take an active role in their health, promoting better outcome across all age groups. So by integrating technology into healthcare, the project enhance community well-being and foster a culture of health education and awareness. So that's all from me. Thank you.